Welcome to this exploration of two significant classifications within psychology, psychoses and neuroses. These terms, while sometimes used interchangeably, actually refer to distinct conditions with different symptoms, causes, and treatments. In the world of psychology, understanding these differences is paramount. To make these distinctions clear, psychologists use a system known as the Diagnostic and Statistical Manual of Mental Disorders, or DSM5. This comprehensive guide classifies and provides diagnostic criteria for a wide range of mental health conditions, including psychoses and neuroses. Differentiating between psychoses and neuroses is crucial when it comes to diagnosis and treatment. For example, a patient exhibiting symptoms of neurosis might require a different approach than a patient with symptoms of psychosis. This differentiation can lead to more effective treatment plans, reducing the impact of these conditions on individuals' lives. Understanding the differences and similarities between psychoses and neuroses is crucial in the field of psychology. So join us as we delve deeper into these two conditions. First, we will focus on psychoses, a category of mental health disorders that affect the mind's ability to understand reality. Psychoses are mental conditions where a person loses touch with the external world, leading to a distorted perception of reality. This disconnection may manifest in various ways, including hallucinations, delusions, or disorganized thinking. Common examples of psychoses include schizophrenia and schizoaffective disorder. Schizophrenia, for instance, is characterized by hallucinations, delusions, and erratic behavior. Now, what causes psychoses? There's no single answer. Factors range from genetic predisposition to environmental stresses. It's often a complex interplay of many elements. Regarding treatment, antipsychotic medications and psychotherapy are commonly used. It's important to remember, however, that each person's journey with psychosis is unique, and so is their treatment plan. Psychoses, characterized by a disconnection from reality, can be quite severe, but with early detection and appropriate treatment, individuals can lead meaningful lives. Now we turn our attention to neuroses, a class of functional mental disorders involving chronic distress, but neither delusions nor hallucinations. Neuroses, also known as neurotic disorders, embody a spectrum of conditions, all characterized by high levels of anxiety or inner turmoil. Common symptoms include obsessive thoughts, compulsive behaviors, irrational fears, and persistent feelings of sadness or worry. Anxiety disorders, such as generalized anxiety disorder, panic disorder, and various forms of phobias, are typical examples of neuroses. Other conditions like obsessive-compulsive disorder and post-traumatic stress disorder also fall under this umbrella. While the exact causes of neuroses are complex and multifaceted, they often involve a combination of genetic, environmental, and psychological factors. Treatment usually includes psychotherapy, medication, or a combination of both, aimed at managing symptoms and improving the quality of life. While neuroses may not involve a loss of touch with reality, as seen in psychoses, they still significantly impact an individual's ability to function and enjoy life. Having understood psychoses and neuroses individually, we can now compare and contrast these two categories of mental health disorders. First, let's consider symptoms. Psychotic disorders such as schizophrenia often present with symptoms like hallucinations or delusions. Neurotic disorders, on the other hand, such as anxiety or depression, are typically characterized by distressing symptoms like excessive worry or feelings of sadness. In terms of causes, both psychoses and neuroses are thought to arise from a complex interplay of genetic, environmental, and psychological factors. However, psychotic disorders may be more strongly influenced by biological factors, while neurotic disorders may have a stronger psychological component. Treatment options for both categories of disorders often involve a combination of medication and psychotherapy. However, the types of medication and therapy used may differ. Antipsychotic medications are often used for psychotic disorders, while antidepressants or anti-anxiety medications may be more common for neurotic disorders. Cognitive behavioral therapy can be effective for both, but other forms of therapy may be more suitable depending on the specific disorder. Lastly, the impact on an individual's life can vary greatly. Psychotic disorders can significantly impair a person's ability to discern reality, while neurotic disorders can interfere with daily functioning due to excessive worry or other distressing emotions. So while psychoses and neuroses may present differently, both require understanding, compassion, and appropriate treatment for those affected. In conclusion, psychoses and neuroses, though different, share a common thread. They both profoundly affect an individual's mental health. Today, we've highlighted the key characteristics of these conditions, from the disconnection from reality in psychoses to the stress and anxiety in neuroses. Understanding these conditions is crucial, not only for effective diagnosis, but also for the development of appropriate treatment strategies. Remember, understanding is the first step towards acceptance and healing. Thank you for joining us in this exploration of psychoses and neuroses.